Hello, and welcome to the West Texas Health IT Regional Extension Center Educational Series. Our speaker today is Cappy Phillips. She will be speaking about mobile devices in healthcare. All attendees have been muted to block out background noise. If you have questions for our speaker, please post them in the chat block of the GoToWebinar pane. Your questions will be read to the presenter at the end of the presentation. If we are unable to answer your question during the allotted time, you'll receive an answer via email. First, some information about our speaker. Cappy joined the West Texas Health IT Regional Extension Center in July of 2012 as a regional coordinator. Cappy has a diverse background with over 20 years of experience in administration and billing practices, with the last 12 years being focused on information technology in the healthcare industry. She's also a licensed workers' compensation adjuster for the state of Texas. Cappy has been extensively involved in researching and maintaining compliance rules and standards for leading insurance carriers, in addition to providing one-on-one client support. She enjoys helping others by providing knowledge and confidence through proper training and support. Thank you for joining us, and I will now turn over the webinar to Cappy. Cappy, the presentation is yours.
Thank you. Okay, minimize that. Veronica, can you see my screen?
Yes, we can see it.
Okay, great. More and more physicians, healthcare providers, and other healthcare professionals are using laptops, tablets, smartphones, iPhones, everything in their workplace to monitor and order patient care. It is becoming more and more prevalent every day, it seems. Mobile devices have become a critical component to sending and receiving vital patient information, imaging, test results, lab results, and consult information to and from providers as well as to the patient and correspondence back to the physician. There are many benefits to the use of mobile devices within a patient practice, and I wanted to go over some of the benefits, pros and cons. It can reduce the travel time for a provider to get to a patient in case of an emergency situation or even an on-call type situation. It also will enable faster decision making for the provider, getting quicker care for the patient. It improves communication with colleagues, staff, and patients, enables remote patient monitoring. It's a lot more cost efficient for your facility to not have a provider come in all the time if they don't need to. Overall workflow efficiency and also enhanced patient care overall. Some of the patient advantages, the federal healthcare law, as you may know, is designed to encourage patients to be more active in their healthcare management and stay more involved. Just the ability to be able to access medical records and test results by a smartphone is fully in line with these goals and would help meet these goals overall. As far as integrating a mobile device in your electronic health record system, depending on the system that you have chosen, a mobile device system application may be offered as part of your purchase, or it can also be added on at a later date. Several electronic health record vendors are working on the integration of mobile devices, and some already have that availability. This will also lead to faster access to medical records, which leads to better communication and, like I've said, overall healthcare decisions being made for the patient. There are a lot of decisions that need to be made before you decide to integrate mobile devices into your system. You really need to determine the type of patient care and the level that you want to accomplish from your mobile device. You can have someone set up to have access only to the medical information, where a provider can only view a patient's records on their device. You can have them, the ability to transmit and receive data. They can have the ability on a lot of devices to store patient health information, and you can also use that as part of your internal network and EHR system. So you have to know what abilities that you want to set forth so that you can obtain those goals. There are definitely threats and different risks that are involved in integrating a mobile device with your electronic health record. It is potentially less secure than a network computer, but there are many programs out there that you can add to your mobile device that will help you obtain the security that you need. Of course, data breaches must be avoided at all costs. You must stay within your HIPAA regulations. Those have to be followed at all times, of course. And then privacy and security must be maintained at all times, and make sure that the patient data is never in the hands of anyone that it should not be. You should, in order to mitigate a lot of these risks, you should definitely name a privacy and security officer to be in charge of the policies in your facility in case of an issue. Develop a risk mitigation plan and strategy in order to conquer these risks, and make sure that that plan is in place at all times and everyone is aware of the plan. Create a prevention and maintenance program to look for issues on a regular basis. Have someone go in and test their system regularly to try to make sure that it is not easily accessed in any way that it should not be, or that there's a problem that you were otherwise unaware of. You should document and create a mobile device policy with procedures to help safeguard and protect the patient health information, and cover mobile devices in your facility's risk analysis. That is a key to make sure that everything is covered and there are no liabilities out there that you're unaware of. Creating and maintaining policies and procedures throughout the organization is definitely crucial, and it's a huge responsibility. It is a large undertaking for one person. You may want to form a team that is in charge of this and meets regularly, and that is something that you can also note within your security risk analysis. And that will help you meet meaningful use objectives as well. A lack of organization could definitely result in major fines in the case of a breach. So you need to make sure that everything is covered from that perspective. Definitely be in the know. Plan for an unknown threat. We all know a lot of the threats that do arise, and we see those in the news often, unfortunately, but try to plan for things that have not been covered and have not happened yet. I know that's hard to do, but try to figure out different ways and make sure that you're covered in every area. Know where all PHI is located within your system. If it is strictly on someone's mobile device and has not been uploaded to your regular system, make sure that that is uploaded often and on a definite regular basis so that it is not just located on the mobile device. You should train your employees on a regular basis about the privacy and security surrounding these systems, and this includes your providers as well. They are just as apt to cause a breach as anyone else, and we all need to make sure that we're protected. So if they have password protection on their mobile device or encryption in any way, to make sure that not just anyone can access their device. And also make sure that your employees are aware of patient privacy at all times, and not to of course discuss patients in an open setting, and make sure that everything is protected. Set those expectations for employees, and they will know what they need to meet. Several safety precautions that you can take would be to configure mobile devices to require the passwords, PIN numbers, or different passcodes that are not easily chosen. Install and encrypt to protect an encryption type program to protect the PHI for the patient. Install and activate remote wiping and or remote disabling to erase data permanently from any location, or also have the ability to lock the information if the device happens to be lost or stolen, and then it can be unlocked once the device has been retrieved. But that will keep the person who has stolen the device from being able to access any information. And it also keeps from any breach whatsoever if you can lock things down from any location. Install and enable firewall capabilities to protect from any unauthorized connections. Of course, keep all of your applications up to date. This will ensure that you are protected as much as possible. Only use Wi-Fi networks and not public networks to send and receive patient data. Public networks are definitely easier to intercept than if it were on a secure Wi-Fi network. Delete all stored health information. If there is health information strictly stored on the iPhone or smartphone, definitely make sure that that is deleted once it's no longer needed for that provider or healthcare person. Download data to a secure location. That can either be an encrypted flash drive or CD, or once they are in your office, a lot of times the electronic health records have the ability to upload information at that time. Just make sure that it is secure. Maintain physical control of the device at all times and never leave your phone unattended. I know this sounds easy, but as we all know, and we've all probably looked for our phone at one point or another, they are easy to misplace or forget from time to time. So make sure that physical control is always maintained. Application information. Be sure and research all apps before downloading to a device that is connected to patient data or your health network. Make sure that it has the right functionality and security that is needed for your job duties. But verify that the app maker, whether or not they claim rights to the patient data for marketing purposes. I've seen several that have language within their agreement that states, from time to time we may use your data in order to improve the service we provide to you. That will definitely warrant further investigation. Usually that means that they have full access to your data at all times and can use it in any way that they choose. So make sure that if it does have that language, that you know in full what that entails. Electronic health record systems are definitely here to stay, so it's not a question as to whether you need these capabilities, but more a question of when. Mobile devices, like I said, are just more and more prevalent every day, and the more that we have patients on these different devices, the more liability that we will have with them. So that just adds to the complexity of providing a secure environment. Many times people are unaware that they have caused an issue, so be sure and educate your staff on the risks and what to do in the case, in case an issue has arisen in order to avoid the patient harm in any way or a breach in any kind of information. EHRs definitely promise to help with the repetitive tasks of measuring vital signs as well as collecting sophisticated diagnostics, and they want those immediately integrated into the system. However, the real time saver would be to have information entered into your smartphone immediately available in the patient's chart seamlessly. So that would definitely help patient care all around. And that is all that I have. Are there any questions for me regarding mobile devices?
Thank you, Cappy. Right now I do not see questions. Let me see, let me check real quick.
Okay.
No, I do not have questions. Well, okay. If for all the attendees, if you have any questions, please post them in the chat block. or if you put them later, we can always ask Cappy and send the response by email. Do you want to add something else, Cappy?
Yes, I just wanted to go over some of the services that we can help provide everyone. As the Regional Extension Center, we have a vast array of different services that we offer. We can give meaningful use gap analysis, different incentive audit preparedness, registration and attestation support for the meaningful use incentives, privacy and security best practices, security risk analysis we can help support you with in creating that for your facility, different stage 1 and stage 2 meaningful use assistance, project management, workflow mapping, even EHR vendor selection, patient-centered medical home education and support, ICD-10 transition support, and also telemedicine. So if there's anything that we can help with outside of today's presentation, please let us know.
Thank you very much. Well, I just want to thank our speaker for taking time out of her busy day to share her knowledge with us. If you have any questions for today's presenter, please email West Texas Regional Extension Center using the email shown, and we will make sure you get an answer. This is all for today. Thank you for attending today's webinar. Goodbye.